To start off, it is important to understand the functional structures of a brain without multiple sclerosis. To do this, it is important to understand what myelin is. Myelin is an insulating layer that surrounds the axons of neurons, composed primarily of lipids. Myelin helps to prevent action potentials from decaying due to electrical current leaking out through the axon membrane. Myelin allows the conduction of action potentials to occur more quickly and efficiently as compared to unmyelinated axons. For this reason, many of the neurons in the central nervous system, that is, the brain and spinal cord, are myelinated. It is important to notice that myelin does not cover the entire axon. Instead, there are gaps in the myelin where the axon is exposed to extracellular spaces. These gaps are called the nodes of Ranvier. When the action potential travels down the axon, it jumps from one node to another. This process is called saltatory conduction. Myelin is formed by glial cells. Though there are two types of glial cells that myelinate, oligodendrocytes are particularly responsible for myelinating neurons in the central nervous system. Oligodendrocytes make up what is known as the white matter in the brain. For this reason, when we look at MRI slides, we can see the importance of myelin and healthy neural functions when we look at diseases where myelin is disrupted. Multiple sclerosis, for example, causes deficiencies in myelin, which disrupts neuronal communication, resulting in a variety of physical and psychiatric symptoms. Let's look at a doctor-patient scenario of this. Hi, I'm Dr. Graham.
Hey,
I'm the neurologist here. Your primary care physician referred you to me for potential symptoms associated with MS. So on your report, it says you've been having trouble with vision, balance, and some leg pain. Can you tell me more about that?
Yeah, maybe it was about 2 months ago. I started to have blurred vision. My vision was declining. But after a little bit, it would get better. So I didn't really think of it as being an issue because it always got better. It was more of like periodically.
Okay, so what was the vision like? Can you describe those problems to me?
Yeah, everything would just get really blurry. And, the worst days I would see dark spots.
Okay.
Yeah.
And you said you had some balance and leg pain. Can you explain that to me?
Yeah, I've started struggling with my balance, which is the original reason why I went to my doctor in the first place. And then maybe it was 4 months ago, I started to get some tingling in my foot, like as if it were to be falling asleep.
Okay, and what foot was it?
That was my left foot.
All right, and about how high up would you say that tingling went?
It started out just at my toes, but recently it's been going up into my calf area.
Okay, is it more of a numbness feeling or is it painful?
It's definitely more painful. It's like pins and needles.
And is there anything that seems to make it better or worse?
This might sound strange. Maybe it's just like, I don't know if this is even possible, but like when it gets warmer, it seems to be worse.
Have you been experiencing any fatigue or weakness?
Yeah, I've been getting really tired lately. It might just be from work or, there's a newborn baby in my house. So.
Oh, congratulations.
Thank you.
Okay, well, is there anything else that's bothering you?
Yeah, also I've just not been motivated in my work. Kind of depressed even. Yeah.
And is that common for you?
No, it's really uncommon.
Do you have any history in the family of MS?
Now that you mention it, my uncle does actually suffer from MS. I didn't think that was hereditary, though.
Well, unfortunately, studies have come out that say that MS in the family can lead to an increased risk of development later in life.
Is this the cause of my symptoms?
Well, since there's no direct test for MS, I'm going to run an MRI and a spinal tap just to make sure that it isn't something else causing these symptoms.
Okay.
This patient listed a few of the more common symptoms, but MS symptoms are variable and unpredictable. MS is difficult to uncover since no two people have exactly the same symptoms, and each person's symptoms can change or fluctuate over time. Let's look at the diagnosis of this patient. Hi, Robbie.
Hey, Dr. Graham. It's nice to see you again.
You too. So, how's it going?
Not that great. My symptoms have been getting a lot worse. A lot more dark spots in my vision. My foot pain is getting a lot worse, and it's even more so than ever harder to keep my balance.
Well, after going through your chart and looking through your MRI slides, I think it has been pretty clear that it is multiple sclerosis.
Oh my gosh.
Are you familiar with it? I know you said your uncle had it.
Yeah, I really don't know that much about it. Could you kind of tell me what it means? Like, I don't really know anything, to be honest.
Yeah, definitely. So, multiple sclerosis is basically, the definition is it's a chronic demyelinating disease of the central nervous system. So, pathologically, what that means, MS is characterized by a presence of areas of demyelination in T cells, which causes inflammation in the white matter of the brain. So basically the immune system is attacking the myelin, which is the protective layer around the nerve fibers.
Okay.
So this is what is causing the scar tissue, and that's what you see lit up, the white spots lit up on this slide. This wouldn't be in a normal brain. You wouldn't see the large white lesion, you wouldn't see all the white spots lit up. That is, what you're seeing there is the scar tissue from your immune system attacking the myelin on your nerve fibers. So because of this, the brain has a harder time sending signals to the rest of your body. So from the way you've described your symptoms, it is clear that you have the relapsing remitting type of MS. So this means that it involves a clear relapse of disease activity. So that's what is the blurred vision and the pain in your leg. That's the relapse portion of it. And the remission is when it appears to get better and your symptoms will go back to basically normal, and then a couple weeks or months you'll go back into a relapse. And the relapse, to be considered a relapse, it has to last 24 hours. But after that, it can last from days to weeks, and then you'll go back into remission, and that can last from weeks to months.
Okay. Yeah, that seems to be kind of what's going on. What can I do as far as treatment?
So unfortunately, there is no cure, but you can live a normal life. There are about 400,000 people in the US right now that do have multiple sclerosis, and however, since there's not a cure, we can offer you some disease-modifying medications that can lower the rate of relapse and can basically slow the disease progression.
Okay.
We can also offer corticosteroids that will reduce inflammation. There's an intravenous treatment, and ensuring that you have a well-balanced diet, exercise, and stretching. Those are really the things that you're going to need to focus on and maybe change in your life. But other than that, there's really not a cure. You're still going to have those relapses. And the weakness and the fatigue, that can be kind of helped with medicine. But
Is this at all contagious? Like, is my family at risk? The people I work with, am I?
so the cause is unclear. Some believe that it is hereditary, and that's not really a definite. The fact that you do have it in your family does put you at a higher risk. And they do believe that it could be from some virus, but no, it is not contagious. Multiple sclerosis is a disease of the central nervous system, where the body, through its immune system, launches a defense attack against its own tissues. Due to some unknown environmental triggers or virus, the nerve-insulating myelin gets attacked by the immune system. When the myelin is damaged, a neuron may be unable to send messages over its axon. In multiple sclerosis, the oligodendrocytes are what is damaged. This can disrupt the functioning of neurons whose axons encase it, causing symptoms such as optic neuritis, double vision, progressive numbness, and bowel and bladder disturbances. Most commonly, these disturbances are found in the form of the relapsing and remitting phase of multiple sclerosis. There's a clear relapse of symptoms and a clear remission of improvement. There is no cure for multiple sclerosis. However, drugs and medications can be taken to help reduce these symptoms.